Are financial incentives working? Well, for more on that, we're joined now by Dr. Peter Chin Hong, an infectious disease specialist. And Peter, thanks for joining us again. You know, we hear these numbers. I came out for $50. If I could have held out longer, I would have. For people around the world watching this, I imagine this sounds ludicrous.
It does sound ludicrous, Roe, but it is, a desperate measure for a desperate time. I think they've tried millions and millions of dollars actually in California, and there is some evidence for cash incentives and health behaviors, but it only gives a modest increase in the percentage vaccinated and only targets people on the fence, not people who have firmly held beliefs.
At the end of the day, spending that amount of money may offset the ultimate cost to healthcare workers and to the health system. We are seeing vaccinations up. Where are we seeing an uptick and where is there still a shortfall in the country?
Yeah, so interestingly, the vaccines uptake has been highest in terms of percentage increase in the places with the lowest vaccination rates, Arkansas, Mississippi, Missouri, and people are somewhat being on the down low too. There are reports of folks who are trying to go in a disguise or trying to be anonymous because, again, vaccines are very politicized in these areas, and people know it's a good idea now, and they're trying to be very cautious in terms of how it appears to their neighbors. In some of the highly vaccinated states, like California, it's a lower increase because so much of the population is already vaccinated. It's in the order of 15%.
And we have seen in some of those states with low vaccination rates, personal appeals from governors and state and local officials. It seems to be working. I want to talk about breakthrough infections, a significant one reported from the 4th of July holiday weekend in Provincetown. What did it teach us about this virus and about vaccines?
So this outbreak in Provincetown really was the main reason why the CDC went with their change in recommendations in terms of recommending masks for vaccinated folks in indoor settings in most communities. And it was because the main surprise was that when you swab the nose of a vaccinated individual who was infected, the viral load, the amount of virus produced, was very similar to that of an unvaccinated individual, implying that vaccinated folks can transmit virus to others. Of course, we need to see the kinetics to see if the slope then comes down and unvaccinated folks shed for longer, more days, and that's what most people believe.
Yeah, I mean, I think we really need to understand what that means, the viral load. So they have this very high viral load in their nostrils, but they're not getting sick from it, but they're still passing it on. So I imagine that's where the combination of masks and mandates, masks and vaccines comes together.
Exactly. They didn't do culture of the virus isolated in the vaccinated folks. So for all intents and purposes, that might be dead virus. They're just fragments of RNA. So I think we need a little bit more information, but nevertheless, it was a prudent move to really sound an alarm bell, which I think is rippling throughout the country right now.
The Israeli president just got a booster shot. That country long been a preview of what's coming for much of the rest of the West. Is this a premonition of what's coming to the U.S., a third vaccine shot for many people?
It is what people are already doing unofficially. There's no official sort of recommendation. I think in the U.S., probably the group that will be the highest in line or first in line for a booster would be the immunocompromised individuals. Those who have received transplants. We know that they don't have as high uptake in terms of antibody response after a vaccine. In terms of the elderly folks like Israel, right now our deaths are really primarily 99.6% in unvaccinated of all ages. So I think for now, I think they may hold tight on the older population.